Which of the following drugs is useful in treating infections from mycobacteria leprae? A. Isoniazid. B. Pyrazinamide. C. Cycloserine. D. Dapsone. E. Ethambutol. The answer is D. Dapsone. Dapsone has been the worldwide standard for treatment of leprosy. The other agents listed are used in treatment of tuberculosis. Leprosy, also called Hansen's disease, is a long-term infection caused by the bacteria Mycobacterium leprae or Mycobacterium lepromatosis. It affects the skin, mucous membranes, and nerves, causing discoloration and lumps on the skin. A 30-year-old man with HIV is being treated with antiviral agents. 4 weeks after initiating therapy, he presents with weakness and fatigue. Laboratory studies reveal anemia, leukopenia and thrombocytopenia, indicating bone marrow suppression. What antiviral agent is most likely the cause of his symptoms? A. Tenofovir. B. Zidovudine. C. Nclex. D. Acyclovir. E. Lamivudine. The answer is B. Zidovudine. Zidovudine, ZDV, formerly called Zidovudine, is active orally and is distributed to most tissues. The primary toxic side effect of ZDV is bone marrow suppression, leading to anemia and neutropenia, which may require transfusions. Additional side effects include thrombocytopenia, gastrointestinal distress, headache, myalgia, acute cholestatic hepatitis, agitation, and insomnia. The other choices are incorrect. Acyclovir is commonly used for the treatment of mucocutaneous and genital herpes lesions and for prophylaxis in AIDS. Acyclovir has no significant toxicity on the bone marrow. Nclex is a protease inhibitor that is characterized by a short half-life and has a number of drug interactions, but its primary adverse effect is diarrhea, and it has the most favorable safety profile in pregnancy. It is not associated with bone marrow suppression. Lamivudine is a nucleoside inhibitor and is an active inhibitor of HIV reverse transcriptase. It is used in the treatment of hepatitis B virus infection. The drug is remarkably non-toxic and adverse effects are mild. Tenofovir is a nucleoside reverse transcriptase inhibitor and anti-HIV drug that competitively inhibits reverse transcriptase and causes chain termination after incorporation into DNA. Adverse side effects include gastrointestinal distress, asthenia, and headache, but not anemia, leukopenia, or thrombocytopenia. Which of the following is an analog of guanine, a purine, and is transformed by viral thymidine kinase before it can inhibit viral DNA polymerase in viruses that are actively replicating? A. Zalcitabine. B. Interferon. C. Idoxuridine. D. Acyclovir. E. Zidovudine. The answer is D. Acyclovir. The chemical type of an antiviral compound is often important in determining its potential mechanisms and, therefore, its utility against specific types of viruses. Interferon is a glycoprotein produced by many types of mammalian cells. It stimulates host mechanisms to prevent viral penetration and also inhibits viral protein synthesis. Idoxuridine, as its name implies, is a pyrimidine, which inhibits viral DNA polymerase. Zidovudine and Zalcitabine are also pyrimidines, but they inhibit reverse transcriptase and act as chain terminators. Only Acyclovir is a purine that requires viral thymidine kinase to be converted to an active phosphorylated form, which then inhibits viral DNA polymerase. Which of the following anthelminthic drugs must be administered intravenously and may cause albuminuria due to accumulation in the kidney, photophobia, and papular eruption? A. Zidovudine. B. Pyrazinamide. C. Cycloserine. D. Diethylcarbamazine. E. Ivermectin. The answer is C. Cycloserine. Cycloserine must be administered intravenously and should be used cautiously in patients with kidney disease. It inhibits protein kinases and dihydrofolate reductase and reduces ATP synthesis. It is used in the treatment of certain extraintestinal nematodes and is probably one of the most toxic anthelminthic agents. The other choices are incorrect. Diethylcarbamazine is rapidly absorbed following oral administration and increases the susceptibility of extraintestinal nematodes to host antibodies. Ivermectin is used to treat onchocerca volvulus in humans and is rapidly absorbed following oral administration. The primary use of pyrazinamide, which is rapidly absorbed orally, is in the treatment of infection from flatworms and flukes where it reduces the resistance of the parasite to host immune mechanisms. Zidovudine is also administered orally, but is used for treatment of AIDS, where most of its toxic symptoms are hematologic. A 42-year-old immigrant from Pakistan comes to your office after his wife noted hypopigmented anesthetic patches on his back. On further examination, you discover bilaterally thickened ulnar nerves. Skin biopsy reveals numerous acid-fast bacilli and a negative leprae test. What combination of drugs would you recommend for this patient? A. Ethambutol, Isoniazid, clofazimine. B. Dapsone, clofazimine, rifampin. C. Pyrazinamide, rifampin, Isoniazid. D. Dapsone, clofazimine, ethambutol. E. Isoniazid, rifampin, dapsone. The answer is B. Dapsone, clofazimine, rifampin. Combination therapy is recommended for all types of leprosy to avoid the emergence of resistance. Cases of lepromatous leprosy are treated with a combination therapy involving the use of the following: dapsone, rifampin, clofazimine. This combination is given for 2 to 3 years, ideally till the skin biopsies are negative. Combination therapy is recommended for all types of leprosy to avoid the emergence of resistance. Cases of lepromatous leprosy are treated with a combination therapy involving the use of the following: dapsone, rifampin, clofazimine. This combination is given for 2 to 3 years, ideally till the skin biopsies are negative. Cases of indeterminate, borderline, and tuberculoid leprosy are treated with a combination therapy involving the use of the following: dapsone, rifampin for 6 to 12 months followed by dapsone, alone, for 2 years. Phoscarnate is toxic to which of the following organs? A. Bladder. B. Liver. C. Heart. D. Kidneys. The answer is D. Kidneys. Foscarnet is an antiviral medication which is primarily used to treat viral infections involving the herpes viridae family. It can cause damage to the kidneys. To reduce the damaging effect, the patient may be put on intravenous fluids. What is Acyclovir's mechanism of action? A. Reverse transcriptase blocker. B. M2 channel inhibitor. C. Guanosine analog. D. Neuraminidase inhibitor. The answer is C. Guanosine analog. Acyclovir is a guanosine analog, which works by inhibiting viral DNA polymerase. This slows down the rate at which viruses can replicate. Acyclovir is used primarily in the treatment of herpes simplex viruses 1 and 2, chickenpox, and shingles. Allopurinol is used for what condition? A. Gout. B. Hypertension. C. Kidney stones. D. Type 2 diabetes. The answer is A. Gout. Allopurinol is a purine analog and xanthine oxidase inhibitor used in the treatment of chronic gout. Which of the following drugs is used in the treatment of osteoporosis? A. Budesonide, formoterol. B. Sitagliptin. C. Alendronic acid. D. Infliximab. The answer is C. Alendronic acid. Alendronic acid, trade name Fosamax, is a bisphosphonate used in the treatment of osteoporosis. Bisphosphonates reduce bone loss by encouraging apoptosis in osteoclasts. Infliximab is a tumor necrosis factor alpha, TNF-alpha, blocker used in the treatment of rheumatoid arthritis and several other autoimmune conditions. Sitagliptin, trade name Januvia, is a diabetes medication. Budesonide, formoterol, trade name Symbicort, is a combination long-acting beta agonist and corticosteroid used in the treatment of asthma. The answer is D. To drink 3,000 milliliters of fluid a day. The nurse should instruct a patient on allopurinol to drink 3,000 milliliters of fluid a day to reduce the risk of kidney stone formation. When allopurinol is prescribed to a client, it is best for the nurse to include the following instructions. A. That the effect of the medication will occur immediately. B. To take the medication on an empty stomach. C. That if swelling of the lips occurs, this is a normal expected response. D. To drink 3,000 milliliters of fluid a day.